Imagine keeping your teeth strong and cavity-free without a drop of fluoride. Many people are curious if you can maintain optimal oral health without fluoride, and today we're diving into exactly that. In this video, we'll explore why some folks avoid fluoride and introduce 5 science-backed natural alternatives, including one backed by NASA. Get ready for a fluoride-free smile journey. Before we jump into alternatives, let's talk about the toothpaste elephant in the room, fluoride. Fluoride is a naturally occurring mineral that's been the go-to cavity fighter for decades. It helps remineralize tooth enamel and can even reverse early tooth decay. Sounds great, right? So why would anyone skip it? Well, some people have concerns about swallowing fluoride or potential health effects from long-term use. Too much fluoride can cause fluorosis or spots on teeth, and there are ongoing debates about other possible side effects. While dental organizations say fluoride is safe at recommended levels, we get it. If you're aiming for a more natural lifestyle, you might want to minimize any chemical additives. No judgment here, you do you. Judgment here, you. The good news is you're not doomed to cavities if you go fluoride-free. There are alternative ways to keep your teeth healthy. Let's explore the best natural cavity fighters that science has to offer. Alright, so what can you use instead of fluoride? Researchers and holistic dentists have been looking at several fluoride-free dental remedies. Some fluoride-free toothpastes use hydroxyapatite as an active ingredient instead of fluoride. These medical hydroxyapatite toothpastes help remineralize teeth naturally. Hydroxyapatite toothpaste. This is a fancy term for a form of calcium that makes up our enamel. It's basically tooth mineral in a tube. When you brush with hydroxyapatite, HAP, you're coating your teeth in the same mineral they're made of, helping to fill in tiny cracks and rebuild the surface. In fact, a recent 18-month clinical trial found that a hydroxyapatite toothpaste prevented cavities just as well as a standard fluoride paste. About 89% of adults using HAP had no new cavities, almost identical to the 87% using fluoride. The researchers concluded hydroxyapatite is a safe and effective anti-cavity agent. Pretty impressive for a fluoride-free option. Fun twist. NASA helped popularize this one. Back in the 1970s, NASA scientists researched hydroxyapatite to help astronauts who were losing minerals from their teeth in zero gravity. That led to the first hydroxyapatite toothpaste being developed in 1978. Thank you, space-age technology, for our new natural toothpaste. Next up, xylitol, a plant-based sweetener found in things like birch trees and corn cobs. It tastes like sugar, but here's the trick. Mouth bacteria can't use it to grow. Streptococcus mutans, the main cavity-causing bacteria, normally feasts on sugar and produces acid that erodes your teeth. But when those bacteria try to eat xylitol, it's like giving them zero-calorie candy. They starve. Studies show xylitol can significantly reduce levels of cavity-causing bacteria in saliva and plaque. One paper even noted xylitol is promising in reducing tooth decay and even reversing early-stage cavities. That's why chewing xylitol gum or using xylitol-sweetened mints after meals may help keep cavities at bay. Bonus, it's dentist-approved in many sugar-free gums. Next up, don't let the name scare you. This one's basically milk protein extracts. CPP-ACP stands for casein phosphopeptide amorphous calcium phosphate. It's derived from casein, a protein in milk, and is used in products like tooth mousse. Its job is to deliver calcium and phosphate minerals to your teeth in a form that can penetrate and strengthen enamel. Research indicates CPP-ACP can slow down cavity formation and help remineralize early lesions in your teeth. Think of it as a mineral-rich paste that seals your tooth surface, kind of like spackling a wall. If you're not into fluoride, using a remineralizing paste with CPP-ACP could give your teeth a mineral boost. Next up, oil pulling is an ancient Ayurvedic practice that has gone modern. It involves swishing a tablespoon of oil, often coconut oil, in your mouth for 10 to 20 minutes. Advocates say it pulls toxins and bacteria out. Sounds a bit odd, but some studies suggest there's something to it. Oil pulling can reduce overall bacteria, plaque, and gum inflammation. In one study, people who oil pulled daily saw their plaque and gingivitis scores drop significantly. Less plaque and healthier gums can indirectly mean fewer cavities, since happy gums often go hand in hand with happy teeth. It's not a replacement for brushing, but as an adjunct routine, it may support oral health. Plus, coconut oil has mild antimicrobial properties. Pro tip: if you try this, don't swallow the used oil. Spit it out in the trash, not your sink, to avoid clogging. Lastly, long before modern toothpaste, people used natural abrasives and herbs to clean their teeth. You might have heard of miswak sticks, which are twigs from the Salvadora persica tree, or neem chew sticks. These have natural antibacterial compounds and have been used for centuries in some cultures. Studies on miswak show it has antimicrobial effects against oral bacteria. Similarly, some tooth powders use ingredients like baking soda, charcoal, clay, salt, and herbs. Baking soda is mildly abrasive and can neutralize acids, and herbal additives like clove oil, tea tree, or neem might help with bacteria or inflammation. While the scientific evidence on these traditional remedies varies, and we don't have as much data as we do for fluoride or hydroxyapatite, many people find they help keep their mouth fresh and clean. If nothing else, they're natural and kind of fun to experiment with. Just ensure any abrasive ingredient is finely ground to avoid scrubbing your enamel too hard. So, can these really replace fluoride? It's the million-dollar question. Fluoride is still considered the gold standard in cavity prevention by most dentists, with a long track record of success. However, evidence is mounting that some alternatives can hold their own. For preventing cavities, nanohydroxyapatite toothpaste has shown comparable results to fluoride toothpaste in both kids and adults. It actually rebuilds the tooth mineral itself, whereas fluoride boosts remineralization by pulling in minerals from saliva. Both end up hardening the enamel, just in different ways. Some research even suggests nanohydroxyapatite might work deeper in the enamel and could help with very early decay spots even better than fluoride, though more studies are needed. Xylitol, on the other hand, isn't remineralizing enamel directly, but it tackles the bacterial cause of cavities. Think of fluoride and hydroxyapatite as fixers of the brick and mortar of your teeth, while xylitol is like a bouncer kicking out troublemaking bacteria. Using them together, for example, a hydroxyapatite toothpaste and xylitol gum, can be a 1-2 punch of protection. In short, you can maintain great oral health without fluoride, but you have to be diligent. These alternatives may help support strong enamel and healthy teeth, especially when combined. Plus, of course, good brushing and flossing habits. Everyone's different, so if you go fluoride-free, pay attention to how your teeth respond. And don't forget to visit your dentist. Just let them know you prefer non-fluoride methods, and most will work with you on monitoring your teeth. Time for a quick fun fact. Did you know, if you're sipping tea thinking you're 100% fluoride-free, here's a twist. Tea leaves naturally contain fluoride absorbed from soil. A cup of black tea can have some fluoride in it. But hey, it's natural, and much lower than what you'd get from toothpaste. So there you have it, a rundown on maintaining a healthy smile naturally, without fluoride. The bottom line? You've got options for oral care, and knowledge is power in choosing what's right for you. If you learned something new or found this helpful, smash that like button and subscribe to our channel for more tips on natural health and remedies. Join the conversation in the comments. Are you team fluoride free? Have you tried hydroxyapatite toothpaste or oil pulling? Share your experience, we'd love to hear. And if you're looking for the scientific sources we mentioned, check out the video description below. We always listed all the studies and links, because hey, we nerd out on the research so you don't have to. Disclaimer: we are not dentists or medical professionals. This video is for informational purposes only. Always do your own research and consult with your dentist or healthcare provider before making changes to your dental care routine. Everyone's needs are different. This is about empowering you with knowledge to have an informed chat with your dental professional. Stay healthy and keep smiling.